Hi everyone, my name is Mia Harris. I did my case presentation on the von Willebrand disease. I'm sorry for all the mispronunciation before I continue. The von Willebrand disease is a congenital blood clotting / bleeding disorder. This disease is caused by a deficiency in the von Willebrand factor, which is a clotting factor or plasma protein that helps the platelet to form a clump and stick to the wall of the blood vessel that has been damaged in order to stop the bleeding. There are three types of the von Willebrand disease. The type 1 is the most common form of the disease, in which the patient has a lower than normal level of the von Willebrand factor and the factor 8, which is also another form of blood clotting protein. So people with type 1 of the von Willebrand disease have mild bleeding and is easily treatable. In type 2, the von Willebrand factor is available but is defective, so it's not working properly, and the bleeding is heavier than in type 1. Type 3 is the most severe and rarest form of the von Willebrand disease, in which there is no von Willebrand factor at all and very low level of the factor 8. So patients with type 3 experience frequent episodes of bleeding from the mucous membrane and musculoskeletal bleeding and soft tissue hemorrhage. Type 3 of the von Willebrand disease are usually diagnosed from an early age due to experiencing bleeding complications. Alright, so I'm going to get into the case study now. So Brian is a 24-month-old infant who was born as a healthy full-term baby at 40 weeks gestation. He weighed about 8 pounds and 2 ounces. His parents are married, they're healthcare professionals, and they alternate their work schedules so that one parent is always home with the baby. The infant is a rambunctious, happy 2-year-old boy who loves to run around the house. The baby is uncircumcised because the parents do not believe in circumcision. Okay, so one afternoon, the infant fell down while playing and injured his lower lip. The father noticed the baby was bleeding profusely and uncontrollably, and the baby also appeared dizzy and cyanotic, so he took him to the ER. So in the ED, the baby was seen by the ER doctor. Because he's only 2 years, so he's not able to voice his symptoms, but the doctors could see that the baby was pale, lethargic, severe bleeding from his lower lip, and he was also crying as well. So physical exam finding, the baby was found to be in hemorrhagic shock, which is a poor tissue perfusion and inadequate delivery of oxygen and nutrients to the body, so the body goes into shock. He was also experiencing tachycardia because of the decreased blood volume, and red blood cells and fluids, so the heart works extra hard to deliver oxygenated blood to the deprived tissues. He was also experiencing tachypnea, which is increased respiratory rate. So this is a rapid, shallow respiration due to lack of oxygen or too much carbon dioxide in the body. So there's low perfusion and hemorrhage. So there's not enough oxygen going around in the system. So the baby is trying to breathe faster to compensate for that. There's also prolonged capillary refill. That's when they squeeze the nails and then to see how fast the blood returns to the nail bed. So the baby has a prolonged capillary refill, so the blood is returning slowly to the nails. He was also pale, lethargic, and had an O2 sat that was below normal at 89%. Diagnostic testings that was done. The CBC was done just to test the level of the the blood hemoglobin, hematocrit was low. Red blood cell was also low as well. The platelet count was normal, and I will explain that later. And also they tested the clotting ability. So the APTT was prolonged at 45 seconds. The PT, which is the prothrombin time, was also prolonged at 15 seconds as well. The normal is 12.5. And also the fibrinogen test was prolonged as well. So other diagnostic testing was the factor VIII level, which was 5%, 5% factor activity, and the normal is 50 to 150. The von Willebrand factor specific test was also done, and it was found to be completely deficient, and it was also uncalculatable, but the normal is 50 to 200. And also the restaucytin cofactor test was done, and it was at 0%, and I will explain that later as well. So based on all of this, we can say that baby Brian is diagnosed with type 3 of the von Willebrand disease. Like I said before, this is the rarest and most severe form of the disease, and it is diagnosed at a very early age due to bleeding complications. So as we can see, Brian is diagnosed at age 2 after his first injury, which resulted in profuse bleeding and hemorrhagic shock. He was diagnosed he would have been diagnosed a lot sooner if his parents had circumcised him. Then they would have realized that he's bleeding more than normal. His CBC was also abnormal, except for the platelet level. So with the von Willebrand disease, it does not affect the production of the platelet or the level. It mostly affects the function of the platelet. So it affects how well the platelet clumps together to form a clot to stop the bleeding. So that's what it affects. Also, as we saw in the lab results, all the clotting tests, the PT, APPT, and the fibrinogen tests were all prolonged as expected due to the prolonged bleeding. So the actual diagnostic test for the type 3 of the von Willebrand disease is the von Willebrand factor. With the type 3, the von Willebrand factor is non-detectable at all, and it's very low level of the factor VIII, as we saw in the lab. The factor VIII was 5%, so it was severely low, and there was no activity with the von Willebrand factor. Also, the restaucytin factor test, which measures how well the von Willebrand factor is working, was also at 0% because there was no von Willebrand factor. So of course the restaucytin factor was at 0%. Alright, so that's that for the diagnosis. And how can this be treated? So the first line of treatment for this infant will be to administer oxygen, whether it's via nasal cannula or the face mask or whatever. Also to increase the circulatory blood volume by transfusing normal saline with red blood cells and fresh frozen plasma, and also to administer Novo-7, which is a clotting factor as well. Other treatments include the hormone desmopressin, which can be administered via injection or nasal spray. This medication works by increasing the release of the von Willebrand factor and the factor VIII into the bloodstream. So this will be done for like the mild form, like the type 1 or type 2. Also, antifibrinolytic drugs can be used as well, which can help to prevent the breakdown of clots, which is often used after surgery. So this can be used as well. Also, women who are experiencing heavy menstrual bleeding due to the von Willebrand disease can also use birth control pills, which can help increase the clotting factor into the bloodstream. All right, this is my presentation and this is my references, and that is all. Thank you for watching, listening.